Corbett, Editorial Director of Black Health Matters, and we are days away from welcome to the road to Charlotte, and we are days away from our award-winning Health Summit, and we will be in the Queen City on Saturday, November 16th. Folks, we need to be more educated about our health. It's a personal issue, it's a family issue, and it's a community issue, right? And I'm excited. So excited to be able to talk more today about our summit with one of our co-hosts, one of our amazing co-hosts today, an author, an educator, an entrepreneur, a talk show host, a matriarch, the amazing Sonya Curry. So welcome, Sonya.
Thanks for having me. I appreciate this. I'm really looking forward to Saturday.
Yeah.
I've never been to a Health Summit Expo, so this is going to be the first time for me, and I'm excited to see all the services that people will be able to come and take advantage of, and for absolutely free. I still can't believe that. I'm like so excited for everyone.
Right. So those of you who have never been to a Black Health Summit, let me tell you about it. Black Health Matters, we are doing this summit for the first time in the Queen City in Charlotte. This is our first time in Charlotte. We will be at the Friendship Baptist Church in Charlotte, and it is free to attend. We'll be there all day, and we are serving free breakfast and lunch. And we will giving there will be panels, there will be free health screenings, and then there'll be a bunch of community health partners. We partnered with more than 30 community health partners to educate people about a number of subjects on top of that. So come on out, folks. But I wanted to talk to you, Sonya, about why you decided to partner with us and to be one of our co-hosts. What made you want to be one of our co-hosts?
Well, one of the things that resonated with me, and you started it off in your introduction, is that it's a family issue, it's a community issue, but it's a generational issue too. And so it just lined up really where I'm in a situation now where I have my mom with me and nursing her. Back to health. She's 75 years old. She's actually for the last 4 years just had one medical issue after another. And so, and never have had her a mammogram. This was the first time she's ever had a mammogram. And so, I was just like, this is really important that we offer this to our community first and foremost. We have to be educated about these things. I think just life in general gets in the way. You get busy and you have all the good intentions to make appointments and get your checkups. And if you have insurance and you have the opportunity to actually go and have the medical checkups that you need on an annual basis. You have good intentions, then it's a matter of how do you get there, and then making your appointments. And I am living this on a day-to-day basis over the
Right.
last 6 months of all of that, scheduling everything, making them, and really encouraging her um, on just why she needs to, well, I've never been to the doctor, well, you've never been until now. And look, all these things have piled up. So, preventive checkups are very, very, very important. So I wanted to be a part of this just to encourage our community to know how important it is and to come out and take advantage of the free resources that will be there.
Right. And then also, just as someone who has given back to the community, this is something that you've been doing for a very long time
Yes, ma'am.
and been involved in community outreach and advocacy. Why is that something, you take that seriously?
Yes.
Why do you think health advocacy overall is something? Why is that critical,
Well,
now?
I mean, it's life,
Yeah.
It's about longevity of life. We are fortunate enough to be a very blessed family. Um, and one of the things that, we've always said in our family is too much is given, much is required. And so to just sit back on, our blessings and be like, okay, everybody else take care of yourself. No, that's not what we're called to do. We're called to take care of and look after our neighbor, and treat our neighbor as ourselves. And so if we can take care of ourselves, we need to encourage other people to do it as well. And so I'm just excited to have the opportunity to be invited to be a part of this and to advocate for our health. We have to advocate for each other's health.
Right. And you spent a lot of time as an educator.
Yes,
So
ma'am.
how how can we, giving the community the tools to manage health conditions change things?
Well, you just have more knowledge, right? It's more than just, okay, my body feels okay today, or it doesn't feel okay today, or waiting to a crisis, a health crisis happens. It's let's think preventive, let's think investing in our bodies and in our temples. It's important to invest in ourselves. And I don't think our community really um, hears that message enough. We are worthy enough to invest in ourselves. And so letting them know why, letting them know how is very, very important. And that's where the education comes into play. To also be educated to know that we're not in this by ourselves. There's so many other people going through these things. And so it gives other people chances to tell their own stories, to encourage, other people that they're not in this alone. And we understand if you're afraid, we understand if you lack motivation. We all go through all these things. And so we need to educate. We need to be educated.
Right. And one of the powerful things about our summits is that you not only hear from like amazing doctors, but patients tell their stories. So you hear the journeys of patients, of their experiences, um, going through diagnosis and treatments and overcoming the triumphant stories of these stories of the patients that they've come through the battles, they come through the other side.
And
And
I think it's important to educate the support system around these people and patients. I
right,
mean, I'm learning that now, like, going with my mom to PT and, her getting back for the first time ever to get into the gym and have a personal trainer. And it's like, I'm like, come on, mom, you can do this. And I'm being educated to be told, hey, look, she made it in the gym. You're worried about whether or not she did it with a good attitude, or she did this many reps, or she walked, around the center of the building and did, one lap versus three laps. And I'm learning how to be an encouragement to her. And so the support system has to be educated in this, because
right,
we have to have encouragement, because it's hard enough. Even those of us, from a workout standpoint, that aren't, struggling with any illness or medical issues, it's hard for us to make working out a priority. So just imagine when you're
absolutely.
dealing with other things as well.
And one step is a good step, right?
Yes.
One step, if you
Yes.
did it, like one step is a good step. Any step is a good step.
Good step.
Any
Yeah.
step in a positive direction is a good step, and we got to encourage and be grateful and be happy that somebody has made the step, right?
Yes.
So, and because one step means leads to the next step, and
Yes.
so that is always a wonderful because you never know how far you're going to go. And once you
That's right.
do that, you look back and you go, I can't believe I've gotten this far.
Exactly.
um,
Exactly.
uh, And then we can talk about what role education plays in prevention. Because we
Mhm.
always, it's one thing to be um, educated about disease management, but then be educated about prevention is a whole nother animal, right?
Mhm.
To know that you can prevent disease,
Yes.
that you can
Yes.
that you can be an advocate for wellness.
Mhm. And that's true. Like, I am learning so much, going with my mom, that I now am like, okay, I need to add this to my yearly checkup. I need to share. I need to learn I need to do research on, the history of my medical history of my family. And, I used to go up until this experience with my mom and be like, no, no, I don't have that. No, I don't have that. And now I'm like, whoa, okay, my mom does have this, so that's something I haven't been telling the truth about,
Right.
um, to my doctors and physicians. And then I'm like, all right, well, I need to check with my aunts. I need to check, and so we need to find out about, our family history and educate ourselves and share that, and get rid of the pride,
Right.
and also lean into the time that you have with these um, physicians and medical professionals, because sometimes we want to get in and get out. And I'm learning to have conversation and find the doctors who want to have that kind of relationship too. Good bedside manner is so important, to be able to encourage patients to just share, you know share, because pride is a huge thing I'm learning.
It
Pride,
is.
and I think just ignorance from the fact that we simply do not know, because we simply haven't asked and educated ourselves.
Right. And I had a conversation with a doctor, a black doctor, who said that his technique is to leave his nurse in the room because he finds that we will not say, because of our pride, that we don't know. His
Mhm.
technique is to leave the nurse in the room so that we will ask the nurse the questions
That's good, yes.
that we are afraid to ask him.
And I've learned to have somebody, like going with my mom, that it's important to have somebody go with you so they can listen, they can watch, how the doctor is responding. And if you just may not know the questions to ask. So it never hurts to have another ear in there going, oh, well, this triggered a question that, I just may have, but it may benefit, the patient that's there that day, just doing a regular checkup, a preventive checkup, or having treatment in that appointment. So it is important that if you have someone to go with you, to take them, because you know what? Another set of ears never hurt anything. Because
Right.
we hear things differently, right? So,
Absolutely.
yes.
And then for those joining us, did you know that this is also a hybrid experience so that if you are not in the Charlotte area, you can join us virtually? You
Yes.
can join us virtually and get the same experience. There are virtual booths that you can go to so you can meet the community partners. You
Wow.
can definitely go to all the panels so that you can have this experience even if you're not in Charlotte, so that you can have this experience and get this education. So you
Now,
can,
I have a question,
sure.
Corinne. So even after the summit, is this information accessible to people even if they can't be there, in person, or
Some of it is
log in? Will this information be accessible to them afterwards?
so the experience is accessible for a certain amount of time, but we have something called the Summit Rewind, and then we have a YouTube channel where all of the sessions, most of the sessions are available.
Oh, nice.
Yes,
Okay.
so a lot of the sessions are still available, and previous sessions are available. Previous Summit sessions are available as well.
Yeah. And
So
I
we
wonder about that, because you go to these things and it's information overload.
absolutely,
And so it's like,
absolutely.
oh, I think I kind of remember, oh, I need to go back and find this information. So that's
And,
good to hear. Yeah.
and in addition, we have something called the Black Health Matters newsletter. So one of the things that we encourage participants to take advantage of is getting the Black Health Matters newsletter, because we send that out weekly, and then so we give them information weekly about different um, diseases, as well as just overall information that they can. So it's bite-sized information, because it is information overload, and
Yes.
that's one of the things that I wanted to ask you. What do you want people to know when they leave, and can we empower them?
Well, first and foremost, just through the existence of this Black Health Matters Summit, you know someone cares. You know someone has got your back. You know someone's already doing research that you may not have time to do. You know someone is already gathering professionals to be able to give you a nugget of information, because you can't get everything in this one experience that morning, but at least you get a nugget and enough to hopefully encourage people to then go and be proactive for their, for their own sake, and do more research. you know you, you've got you've got resources. There are people that know about Black health, and we don't think that, I'm, in a new area part of the year, and it's like, where is my community? I have to seek out, other Black professionals here, because what I'm also learning from, female perspective, that, there are certain medications that I've learned, and even with my mom, that doesn't really work well with Black female anatomy,
Right.
as far as treatments. And so it's important to know that there are resources for us specifically as Black men and women. And I want the professionals to leave uh, encouraged that the work that they're doing is appreciated as well. So again, this is a two-way street here. We're coming to gain information, but we also want um, the work that Black professionals are doing right now to be recognized as well. And so their participation to be applauded, and them volunteering as well. So I just want everybody to be encouraged that we can do this thing.
Yeah.
Like, we can do it.
So let's talk about actionable steps. If we can encourage people to take one actionable step, what would it be?
Well, I would probably say the first actionable step, leaving the well, sign up, come to the summit, be in attendance, whether in person or log in. Um, if a friend can go and you can't go, have the friend or whoever gather information. I'm sure there'll be plenty of printed information and cards for people to take, back from this experience. That would be one actual item. If you are coming and you have friends don't know anything about it, bring somebody else with you. Make it a date. Get your girlfriends together, your guy friends, and just come for an hour or something, and just come together as a group, support each other that way. And then the third would be to just follow up when you leave. Follow up with your primary physician. If you don't have one, then do research on how to get one. Um, Come to Expo and find out how to actually take those steps. But start there. Make an appointment. We got to make an appointment.
That's a great actionable step. Now, I have a question about you and your family because your fitness is a foundation for you guys, right?
Yes.
So, what have you learned and what can we learn from you guys about putting fitness, incorporating fitness as part of our lives?
Well, you know what? That's a good question, because I was just having this conversation, because we are athletes. So we've kind of been forced into uh, healthy lifestyles, and, staying fit, and we're very, competitive. And even within that, I want to encourage people to know that, when the lights are finished and, they'll retire, without having somebody there to tell us what to do, we had to be disciplined and find another gear to get ourselves disciplined on our own, because we were so used to coaches and other people trainers telling us what to do. And that was huge. And I was like, even for myself, the transition. So I still kind of struggle a little bit with consistency of working out. But I've given myself a lot of grace with that. Like, I think sometimes we put too much pressure on ourselves. So I'm like, you know what? Find something that works for you. You can just walk. And I think that's the other thing. We get overwhelmed with all these diets and with all, these workout plans. Just start simple. So we say, keep it simple, stupid. Not that anybody's stupid. I don't want
Right,
but keep it simple, Sally, or keep it simple, Sonya. I'll say that.
right,
And start with something like that. Just get out and walk around your block. And then if you want to add exercises, just do leg lifts or do jumping jacks. And just don't try to overwhelm yourself. Don't say, oh, I got to get a gym membership. You can do it at home. There are so many simple things to do, but you just have to start. You gotta start. And I'll say the simplest thing to do is just walk around the block. Walk your dog every day or your pet, or just get a neighbor and say, hey, I'm going to walk down to your house and you walk back. But just start, put your feet on the ground and start small, simple. And then the other thing I just learned, because we are athletes, we actually overstress our bodies a lot.
mm,
And having this experience with my mom, a trainer told me something very important the other day. He said, you come in here, you've got me, and I can ask you, did you get enough sleep last night? Did you eat this morning? And are you hydrated? And if those three things aren't check, 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 he actually alters the workout because he says your body will be stressed. And the exercises that we do actually could have a counter effect on you
mm,
because when your body's stressed, it produces fat, right? So it's like, I went, what? I'm like, oh, I have never heard that. I've always heard do more, do more, do more, do more. That's what our family is. And I'm thought, that is so smart. Sleeping, eating well, and drinking water, and then adding the exercise is so, so important that we realize that stress, there's different kind of stress. There's good stress and there's bad stress. And really too much without fueling your body, without resting, can actually become bad stress for you.
right. So I was going to ask about, given that all that particularly Black women have been exhausted lately, what we need to do, and that's the answer: sleep,
Yeah.
rest, drink
Sleep.
water.
I mean, I'm learning. I used to get laughed at like when I ran my school. I mean, I was like 15, that 15-minute lay your head on your
Right,
desk, or it works. Like it really does work. And if you are tired, and I know some women are like, well, I got, I got the, you really can. We really can just stop and calm ourselves down, quiet ourselves, even if we don't even go to sleep. It's just stopping things and letting your body breathe, breathing, learning, the breathing techniques, because in life, the only thing we really can control is our breath. That is the only thing we can control. And most of us are walking around holding it. And that's why we're going, because our body's going, you got to breathe. And so, yes, we can stop, and we can give ourselves permission to stop.
yes, that is it. And we have to give ourselves permission to attend the summit, whether
Yes.
they're coming in person or they're coming virtually. Because if you come in person, you will see Sonya Curry. This is why I'm telling you to come in person. You will see Sonya Curry in action, and but you can see her virtually as well. And
I think I'm gonna do one of the exercise classes. I'm looking forward to seeing
yeah,
the guru of abs. I
it
need
is.
that in my
Wait a
life
minute.
right
Let
now.
me tell you something. Let me tell you. You will see these senior women, and you will be what?
Okay.
Th- The he had. I'm going to tell you, the senior women that follow the guru of abs are a sight to behold.
Oh, I'm excited.
It is amazing. It is amazing. So yes, you do want to see that. for sure. But I am encouraging those who can to come out to the summit in person at Friendship Baptist Church. Register, 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 please, and join us because it will be an amazing experience. You will leave full of information. Even if you are overwhelmed, please follow Sonya's advice and do the
One thing.
one thing, and you will be forever changed. Thank you.